What's up, guys? This is Dr. Waldeck with Health Source Chiropractic of Decatur, healthsourcechiro.com. We're doing a follow-up video today on fibromyalgia. We did a video a couple weeks ago. We had a good response from that, but we had a couple questions from some of our patients. And I brought in a guest speaker to help with this. This is Dr. Kelly. Dr. Kelly, can you introduce yourself to the audience?
Of course, I'm Dr. Kelly. I'm an osteopathic medicine doctor. I specialize in sports medicine and emergency medicine.
And he's based out of Huntsville and here in Decatur as well. And what I wanted to talk to you guys today about is some of the different things with fibromyalgia. And one of the studies around shows that different management, co-management between different types of specialties can help patients with fibromyalgia better than perhaps medication alone. And Dr. Kelly, can you talk about some of your patients you've seen with fibromyalgia and what type of experience you've had?
A lot of patients with fibromyalgia, they experience a lot of chronic pain. And you deal with it on a daily basis along with stiffness and all these other symptoms that are treated. But most medical doctors, we treat the symptoms, not the actual problem. And you're sitting there taking medication, but you're not really doing anything else but treating the symptoms and not the actual problem. When it comes to co-management, it takes a couple of doctors to be able to actually understand how to treat those symptoms and actually how to co-manage. So when we come in there, we know, well, exercise is the #1 thing that we want to recommend to them. We want to get you moving, we want to get you active. What that does is it gets the blood going, it gets the blood pumping, it gets those muscle stamina, gives the muscle stamina. It also boosts your energy level. It keeps you from being depressed. It actually reduces the amount of medication that you take. And then on top of that, you feel better.
Yeah, absolutely. Yeah, and it can also boost your immune system too, and may reduce your dependency on medication long term. And you know, one of the things we see with fibromyalgia is chronic inflammation in the joints, like Dr. Kelly said, and that chronic inflammation can lead to immobility in those joints after time because you don't want to move them because they hurt.
Yes.
So what we do as chiropractors is work on restoring mobility into those joints so they can free up and some of those toxins can work their way out of the body. And one of the best things to do on top of that is to exercise to help get rid of some of those toxins. Would you agree?
Yep, I totally agree.
Yeah, and what we've also found too is exercise can help reduce the number of flare-ups and also the intensity of those flare-ups just by improving circulation and getting more oxygen into your blood and helping with removal of those toxins.
It also it increases the range of motion with the muscles and in the joints. And when it comes to the spinal, it's so easy for that spine to lock up on you. And nobody wants to move. That back feels kind of, just resistant to the pain. And what it does, it puts you more on the end where you are making the symptoms worse by not being active. It's not that we're pushing you to say, don't take your medicine, exercise. No, what we're saying is start exercising to reduce the amount of medication that you're taking.
Yep, and one of the other chronic symptoms with fibromyalgia is disturbance in sleep, and that can lead to depression in itself.
Yes.
And some of the benefits of directed exercise are improvements in your sleep overall.
Yeah. With depression, chronic pain, lack of sleep, those are all signs of depression. And when you start getting really in the mood of where I don't want to do anything or I don't want to move, and the symptoms are getting worse. And see, the thing is, when you actually start the depression cycle, you don't understand that exercise gives you that energy. It makes you want to move, and then it improves you on your sleep method, and then it improves you on your mood in the morning time. You don't have to drink coffee. You don't have to take medication for pain. You actually go in and you say, well, I feel better today. I don't need to take the medication. I may take it tonight. I may not have to take it in the morning.
Yeah, and in Health Source, we're all about being proactive, and of course, you want to consult your physician before you begin an exercise routine, but one of the things that I like about Dr. Kelly is he performs a medical evaluation and determines what are his patients' limitations, what are their capabilities, and kind of makes a directed plan instead of just a blanket exercise statement. And I do encourage anybody with fibromyalgia to begin exercise if you're capable, okay, and if you're medically cleared to do so. But that's why we've had success referring some of our patients over to Dr. Kelly.
You just need to remember that even though you're a fibromyalgia patient, every workout is individualized to you. You're no different than somebody that doesn't have it. So you don't want to go in and try to make your own plan. You need to make sure that you take it slow, start out. Most people want to know that, well, I work out 30 minutes a day. I take it at 10-minute increments. You come in and you see us, we build that plan for you. We start that treatment plan for you. He knows how to take care of the spine issue. I can sit here and make an exact plan that will treat exactly along those lines to help you improve your health. So I always send my patients to Alex.
Yep, guys, and we're going to open this thread up to question and answer. So if you guys have any questions directed towards Dr. Kelly, please post them in the comments below. Same thing to myself, or if you want us to both handle those questions, we'll be around. You can give us a call in our office. The phone number here is 822-1010, or go to healthsourcechiro.com. And Dr. Kelly?
My office is 256-716-9139, and you can go to kellyelite.com. You can send a direct message. We'll get back with you as soon as you send it.
Yep, and we'll look forward to seeing you guys in the next video.